Legion of Marian virtual presentation featuring emergency and trauma services. We have Dr. Alicia Gonzalez-Kurtz and Christine Sewell here talking about emergency services and trauma. Emergency services is being considered as a funding opportunity for this year's Legion of Marian proceeds. So thank you two for being here with us to talk about that. And I'm going to give the floor over to you guys.
So like she said, I'm Alicia Gonzalez. I'm the medical director of the emergency department.
I'm Christine Sewell. I'm the nursing director of the emergency department.
And we, of course, think that there is no better place in our hospital at Marian that proceeds could go to at this time. So if we start by looking back at the past year with the COVID-19 response, well, I think everybody's very aware of the toll that it took on the ICU and on the inpatient services. And we are so grateful for how those teams responded. Sometimes we tend to get missed. And so we wanted to highlight a little bit of what we did. We, first of all, were one of the most prepared from a disaster point of view before we even started, because we work with Diablo Canyon. We do these yearly drills. Our team, Christine has special training even in disaster medicine. And so we were ready to think about this no matter how it was going to go. And so we made flow changes to how it works when patients come to the ER. We had the PPE, worked with the hospital to make sure that we were all protected all the way through, ways to separate patients, ways to get testing done quickly. And then even expanding that to our staffs, ways to keep our staff safe, ways to get them tested, all of those kinds of things. It was a machine. And we did this really efficiently, really effectively. And we were really, really proud of the work that we did.
And having the emergency department expansion that had happened about a year and a half prior to COVID was kind of a godsend, because we were able to basically make two emergency departments, one for our COVID patients and one for our regular patients, because believe it or not, there was actually emergencies in COVID that weren't related to COVID. So we had to be prepared for both. So on the screen, you see that there's an orange area and a green area on the map, and that shows you our COVID versus our non-COVID in the beginning, when we didn't know how COVID was transmitted, and we had to be very, very careful with all of our patients. So having the other nurses station and supply rooms and everything back there, along with the shelled space that served as our hot zone, and also another entrance into the ER, really allowed us to safely care for our patients.
And so in the process of doing this, a phenomenon that happened across the entire country is that emergency department visits, the volume overall went down. But what did not go down was the number of sick patients that came to the ER. And so our team was able to continue caring for very sick patients, which was exhausting, but we continued to excel. And so as a dyad, Christine and I, with the other leaders in our department, we have worked extremely closely with the stroke services, with the STEMI, the heart attack services, and then now also with our trauma services, to keep the quality of the care that we're offering, not even just to where it should be, but above that. We're continually working to improve that care. And regionally, we definitely shine. I won't say names, but certain competitor hospitals maybe get upset because we do such a good job with the things that we do. But we really didn't lose our focus, our North Star, that we want to be a very high quality receiving center for all our patients in our community and be able to do everything here at Marian that they need. And we didn't lose that even in the face of COVID-19.
I think we added to it.
Yeah, we definitely added to it. You want to go to the next slide? So when we talk about some of those things that we are really excited about and that we've been working on really hard, this slide really highlights some of those things for us. So first, I'll talk a little bit about the trauma designation. We have been operating as a level 3 trauma center, but realistically, the way that the emergency department runs, we function at a level higher than this. We have been at a level 2, we are at a level 2, and we're ready for our entire hospital to move to a level 2. This is really important because what it means is that in the field, when patients are seen by an ambulance for trauma, right now, depending on the injury they have, they sometimes have to get diverted to Cottage Hospital, and they can't come to us because we're not the right level. And we know that we are capable of that, and so we want those patients to come here. So we've been working really hard with our trauma team to check all of the many, many boxes that it takes with orthopedics, with trauma surgery, et cetera, to make sure that our entire hospital is ready for this, because the ER has been ready for a long time. And so we're very excited to say that as of now, we are functioning as a level 2 trauma center. This is a very expensive endeavor for sure. There are a lot of costs that come with maintaining this level of trauma designation, but we've already started to see the acuity of the traumas that are coming in has been rising. And we've already started to see patients noticing that increased quality of our care. Mm-hmm. So as a part of being a big functioning trauma center, also one of the programs internally we've been building is our point of care ultrasound program. So all of our doctors in the ER are trained on how to use ultrasound at the bedside. And we do it, it's just that the equipment we have is pretty old and really clunky, and it doesn't have the ability to communicate with Cerner the way that we would want it to keep that information safe, but also to store it for quality review purposes and those kinds of things, and educational reasons. And so we've been trying to obtain new equipment. We have lots of workarounds that we've been doing to make sure we're still able to get those scans, but certainly the ultrasound equipment, the machines, the storage equipment that we would use, which we then in turn are also going to be sharing with the the family medicine residency program, because they're very interested in learning point of care ultrasound, and our ER doctors really are the experts at this in the hospital. And so when those residents rotate with us, it helps to augment their education as well.
Very good.
I said augment. I feel very, I feel very fancy.
Well,
Okay.
thank you, ladies.
Thank you.
Thank you. We'll see ya.
Bye.
Bye-bye.